Hi, I am Dr. Samir Ali Parvat. I am a senior consultant and head of joint replacement and arthroscopy, Maitra Hospital, Kozhikode. Today I am going to talk about the principles and philosophy of rotator cuff repair. The philosophy of the treatment is basically to restore the equilibrium between the functional demand and the capacity of the remaining cuff. So we have different options. Either we have to lower the demand, the functional demand of the patients. Sometimes many of the time that won't give the results what we want. Then comes the second options, that is substitute the cuff either by a tendon transfer or a reverse total shoulder replacement. But that also won't work many of the times. So what works better and better, that is you recreate the anatomy. That is the anatomical rotator cuff repair. And that's what we all hear. But even though we are planning for an anatomical rotator cuff repair, but in certain circumstances we have to suspect some difficulty, especially when the patient is older, like more than 65 years, or it's a chronic tear, or there's an severe fatty atrophy, more than grade 3 or 4 gutaliar fatty atrophy, and the retractions, fatty retraction of more than grade 3, that's almost reaching up to the upper border of the glenoid. And then if the acromioclavicular distance is less than 5 millimeter. So we are looking for a proper tendon healing. What is required for a proper tendon healing? One is a good biology, that is the inherent itself for the patients. And then secondly, the most important is your good surgical technique. That include you restore the anatomy, you have to get a strong initial fixations, and there should not be any gaps between the bone and the tendons. So all these will give you a pain-free, with a good range of movement and a good strength and functional outcome. That's what all we want for. So presently we are doing a lot of anatomical rotator cuff repairs. So we have come up with initially a single row, then the double row, then even the triple row. So there are a lot of increasing variables to get into the trouble. Like so you have a more time, more sutures and more swelling. So we always need to be stepwise to attain the goal what we need. So what are the steps that you have to follow? One is to get the space with the proper portals and soft tissue releases. Second, know the anatomy properly. You identify the tissues, then do the releases. Then pass the sutures, followed by tie in order. Be careful with the dog ear formation or gap formations. And then finally, never do an over tight. So what are the portals you usually required for a standard rotator cuff repair? One is always your posterior portal, followed by you require an anterior portal for the diagnostic arthroscopy. Then the next will be main working anterolateral portal, basically the lateral portal. And then after that you put your scope in the lateral portal, and from then you will make a posterolateral portal as a permanent viewing portal during your further procedures. And you might require very minute portal just as close to the edge of the acromion to put your suture angle as perfect angle as possible. So then the next step is to get the space. Okay, so you have to release the lateral bursa. Almost always do a thorough debridement of the bursal tissues and release the adhesions what you see in here. Basically once you do a proper adhesion release with your RF abrator, you can see your cuff is starting to get mobilized and your visibility become better. Because when you go more and more, the fluid will swell up into the soft tissues, and also your cuff will come to the lateral end of the acromion. Then you will find it very difficult to properly visualize the tissues. That is why in the initial phase, if you spend 3 or 5 minutes extra for the proper bursal tissue clearing, so that will save you a lot of time in the later. Otherwise, instead of the 5 minutes, you have to spend another 5 hours to get a proper tendon repair.